why ketamine? Our traditional treatment of depression is based on either a lie or a half-truth. That's because antidepressants were, or at least the pharmaceutical companies, were very successful about a marketing pitch. Now, if you ask anybody what causes depression, even the general population, a lot of people will say it's a chemical imbalance in the brain. And that was the marketing pitch for early antidepressants. Even much so that the clinicians say the same thing, the textbooks will tell you that. However, if it was just a deficiency of serotonin, dopamine, or norepinephrine, you would think that more people would respond to antidepressants, right? So that's probably a partial truth, right? So you would think, because all of our energy is focused on those three chemicals, that would be like the most abundant chemicals in the brain, but actually only make a very small proportion of neurotransmitters in the brain. The two most abundant neurochemicals in the brain is going to be glutamate and GABA. Think about it as the gas and the brake. So if you really think about it, your nerve cells are designed to do one thing, and that's fire, right? That's their job. And God is so smart that he thought of everything. Like, if you think about it, you need a way to turn the nerve cells on. You need a way to turn the nerve cells off. Or there'd be no coordinated movement, right? There'd be no coherent thought. We just walk around having seizures all the time, right? Because the nerve cells are always on, or you'd be dead. The nerve cells are always off. There's no way to control that, right? So there's a balancing of glutamate activity and GABA activity. So if you look at where some of the research is going on depression care, a lot of it is glutamate focus, turn your nerve cells on. So here's kind of how I remember this stuff. I think of the brain as like a high performing vehicle, right? Let's just say a Hellcat, because I drive one. So if you think about a Hellcat, like you can rev that engine. It makes a lot of noise, and you can be obnoxious to your neighbors, and you can like do donuts and get all the attention, and the girls like, whatever, but you're still gonna rev your engine because it's a high performing vehicle. It needs to roar, right? So I think the brain is that way too. The brain is designed to fire and to perform and to think and to create and to imagine and things like that. But that car won't perform well if I drive it around with the parking brake on, right? So I can rev the engine as much as I want, but it's not going to like move forward and perform to its highest potential with the brakes on. So when we think about depression, it's like the nerve cells are just not firing as much as they should. It's like there's something that's stopping them from firing. So when someone struggles with depression, the brain starts changing. And the longer they're in that state, the harder it is to get them out of it. Right? So you're creating new neuronal pathways that reinforce the depression. Because here's one thing about depression that is important for you to understand if you haven't experienced yourself, is that depression is recurring. Like it's always following the person. It's incessant, and like it doesn't stop. It is intrusive. It's unwanted, right? And those are the characteristics of their thinking too. It's like you're always thinking things are not going to go right. You're always thinking, something negative about yourself, and that reinforces those neuronal pathways. So the longer it's that way, the harder it is to get them out of it. So introducing services earlier, creates better outcomes for your patients. And when we add antidepressants, it's like putting more gas in the car. Putting more gas in the car, but it's not accelerating because the parking brake's still on. So in that analogy, the parking brake are interneurons. Interneurons' job is to regulate the firing of the nerve cells. And they work primarily through the action of something called the NMDA receptor. So that's the new wave in psychiatry, the NMDA receptor, A lot of new drug targets are looking at the NMDA receptor because it works like the parking brake on the brain. So my personal hypothesis is for the patients who don't respond to antidepressants, it's probably we're putting gas in the tank and telling the brain to go, but the parking brake's up, so NMDA is too active. So even though we're telling nerve cells you need to fire more, they just can't because they're inhibited. So ketamine and esketamine, also known as Spravato, work by blocking the NMDA receptor or blocking that receptor. It's like releasing the parking brake on that high-performing car. And that's why it seems that these chemicals seem to work better in conjunction with antidepressants than alone, even though they can work alone. In fact, Spravato just got FDA approval for monotherapy, so it can work without an antidepressant. And I've definitely seen ketamine work outside the context of an antidepressant. So when we remove that parking brake, what happens is it tells the brain to release more glutamate. Rev the engine more. Vroom, vroom, vroom. So one thing that really stands out to me is like it all starts piecing together. Like all the puzzle pieces start coming together. Because like if you do a functional MRI on someone without depression and compare that brain scan, or you can do a PET scan, to someone with depression, if we're looking at the metabolic activity of the frontal lobe of the brain, a normal person is going to be lit up, a lot of activity. Person with severe depression, it's going to be dark. There's not going to be a lot of activity because it's measuring glucose metabolism, how much sugar the nerve cells are using. So there's clearly a functional difference in the brain between someone with a normal behaving brain and someone with a depression behaving brain. Also, we do spectral EEGs to look at the speed of the brain cell firing. And when we look at those scans, patients with depression, their brain slows down. And it's making slow waves when it should be making faster waves. Right? So it makes sense that, hey, if I can increase the amount of excitation or increase the speed of the brain, it should help you with your depression. Does that make sense? All right. So in a nutshell, ketamine works by encouraging the nerve cells to fire more, especially in the front part of the brain. And this action happens pretty instantly. It happens within a few minutes of administration of ketamine. Here's the great thing about it, though. Ketamine kind of works in a few different ways. One, it works like mechanically, like I'm giving you a chemical, and mechanically I'm increasing glutamate, and the nerve cells are firing more. That's part of the way it helps. Second way it helps is there's some things that happen after you get this increasing firing. So, like you go to the gym, right? And when I go to the gym and I, get on the bench press, right? So normally when I'm warming up, I'll put, 2 or 3 plates, 245s, you know what I'm saying? I'm warming up, 315 maybe. I may pump out another, 20, 30, maybe 40 reps just to warm up, right? Then when I get to my set, I put another 6 plates on there. I'm benching, 1,000 pounds, something like that. That sounds about right. But what that does when I'm benching 1,000, right? It's tearing up my muscle cells, telling my muscle cells to get even more superhuman than I already am, right? And when I go home and I eat a whole chicken and a turkey and a wild boar, right? That protein plus my body's own mechanism to grow my muscle cells back makes my muscles bigger through testosterone and growth hormone. Turn them into this man beast that I am, right? So your body has natural mechanisms to adapt to the environment. So the same thing happens in the brain. So when I increase this neuronal firing, the brain's firing a lot more. Well, guess what? There's an adaptation that happens. So the brain releases something called BDNF, or brain-derived neurotropic factor. Think of it like fertilizer for the nerve cells. It encourages neuroplasticity. That's like the holy grail in psychiatry in some ways. So for our patients that have not been able to experience relief from depression, they've been dealing with it for years, the brain is very static. That's why they're stuck in the way they're thinking. So when we excite the brain, you get this release of BDNF, it becomes more plastic, more formable, open to different ideas. So ketamine will open what's called a critical window, which is a 24 to 48 hour window where the brain is more plastic and pliable. So that's the second way that it has a mechanism of action. Third way is the experience itself. And this is the part that I feel like is underutilized in ketamine clinics and centers that administer Spravato. Is like ketamine is a very internal experience. And people have what I call the epiphany moment. Like they may, realize that something that they've been stressing out about, it's not as big of a deal. They may forgive themselves for trauma that happened to them. They may, make peace with someone who's passed away that was holding them back. Or they may forgive their parents for things that were done to them when they were young because their brain is thinking differently and seeing problems from a different perspective under the influence of ketamine or esketamine. I call that the epiphany moment. So the experience itself, if it's protected, can be used as a therapeutic agent. So those are the three things. The direct action of the medicine by increasing firing, the secondary effects of increasing neuroplasticity through the release of BDNF, and the experience itself. So the phase one of when you experience ketamine is something called the relaxation phase. So the relaxation phase is the first phase where your body starts perceiving that you are receiving the medication. Keep in mind that ketamine is typically an anesthesia medicine, right? So as the dose starts getting to your bloodstream, the first thing most people recognize is like, relaxation. They may feel their body getting more heavy. Since I am trying to take advantage of the experiential part of ketamine, most of the time I'll try to work people through breath work leading into their treatment. And I give them kind of like a self-hypnosis process. So I'm teaching my self-hypnosis, I'll tell the patients, okay? So to help people transition to that relaxation phase, I help them understand that, there's that fight or flight, sympathetic, and then there's the rest and digest, the parasympathetic. So we're trying to activate the parasympathetic. So I want them to relax and be calm as they go into their experience. So what I teach them to do is something called resonance breathing. So in your fight or flight response, the only thing you can control about that is your breathing. You can't control your heart rate. You can't control your pupil dilation. You can't control whether you sweat or not, but you can consciously control breathing. So I teach the patient that we focus on our breath because it controls how activated the brain is. Then the second part of the self-hypnosis part is I teach them, after they kind of get into a rhythm with their breathing, their next thought is to start scanning their body for tension. So a lot of people hold stress in their traps or in their arms or they're uptight like this. I'm having them scan their body with their mind. And as they exhale, their visualization is to imagine that their muscles are like a cold stick of butter sitting on a warm skillet. So when they exhale, I want them to visualize that butter just kind of melting slowly into the skillet or deeply into the chair. So what I've learned is that visualization plus that breathing technique will put people into a deeper relaxation experience. And then when the ketamine kicks in, it naturally pushes them into a relaxation, makes it deeper without having to use a higher dose. Okay. So phase one that we're trying to take advantage of is the relaxation phase. That puts the person at ease and tries to help them from being overwhelmed with their thoughts. Phase two. So the second phase of this experience is what I call the trance phase. The trance phase is when the mind starts noticing that thinking is different. So when patients reach this phase, what they may experience is just a clarity of thought that they typically can't produce on their own. It's almost like a meditation. So what patients have described to me is like the chatter in your mind, it starts reducing. So, for example, like, I don't know about you, maybe my brain is broken, but a lot of times, like, I may be having a conversation with my wife And in the back of my head, oh shoot, did I turn the stove off? Or wait a minute, you need to hurry up, I gotta go do this. And I hear the TV go off. I'm like, oh shoot, what are they talking about? And I'm like thinking about all this other stuff, but I'm still listening to her. But there's a lot of other chatter that's going on, right? It's probably ADD. But for a lot of people, they can think about multiple things at once, but be focused on the main thing. In the trance phase, the chatter significantly goes down, and whatever you're kind of thinking about or focus on, it gets very clear. It's like I said, it's like a meditation. Like your thinking becomes very clear about whatever you're thinking about. You may, if your eyes are open, you may notice details about things you wouldn't normally notice. The reason for that is because the brain is a really great filter. It filters out unnecessary information. The brain picks up on a few things. It picks up on dangerous things. It picks up on weird things. It picks up on sexy things. It picks up on free things, right? But everything else gets filtered out. So when you're having a ketamine experience, like all that stuff we would normally filter out, your brain's like, wow, those curtains are really interesting. I never noticed the texture is really nice. I want to touch it. Like you'll start noticing things that your brain normally filters out during this trance phase. And it's like this transition from your normal state of thinking to an altered state of thinking. Okay. That's phase 2. Phase 3. Phase 3 is what I call the transformation phase. Like this is your money phase. So this is the phase where the healing that happens from the experience tends to happen in the transformation phase. This is the time when your blood concentration of the ketamine is at its highest, and you're getting the most impact on the brain from the ketamine. This time, this is where people just have a variety of experiences, and it can be as mild as, well, just really, my thoughts just kind of turned off. It was dark, which is like very rare, but possible. To more on the fur end of things that people have these very, very distinct, complex visual experiences with their eyes closed. It's like an internal experience. Like I've had people describe flying through the solar system, seeing the stars, understanding the nature of the universe because they've been there in their mind's eye. I've had patients sit and meet with Jesus and sit at his feet and listen to his will for them. I've had patients reunite with loved ones that's passed away to make peace with them because they didn't have a chance to make peace with them when they were here. I've had all type of situations that come up that can be just earth shattering for the person. And I think that period of the transformation phase can be the most profound and impactful, but also, if not shepherded the right way, it can be very terrifying. Okay. So the transformation phase is also the opportunity for a patient to go off the rails and go into a bad trip. So a bad trip can come from a variety of things, like being in the wrong headspace coming into a treatment, not having the right preparation and not knowing what to expect, inappropriate dosing. So I mean they got too much or they got too much too fast, and not protecting what we call the set and the setting. So when you hear people in the psychedelic space say set and setting, it's referring to the mindset that the patient is in and the environment or setting that they're in. And it is crucial to protect those two things when you're doing a ketamine experience, because you're trying to leverage that transformative time that they can have, which is that neuroplastic time. Okay. So maybe the next time I'll teach you like my most, okay, I can't do it. I got to do it now. Okay. I'm going to tell you some of the worst bad trips I've seen. Okay. Here's the worst bad trip. Okay. Here's a true story, right? So I was treating a patient. It was one of my personal patients. I had worked with him for years. He was like OCD and like some pretty severe debilitating depression. Christian guy. And he came into the ketamine experience. His mother was with him during the experience, and she had just kind of got through chemotherapy, and she was just so thin and frail at the time. And he had done 5 previous ketamine experiences and did wonderfully. On the 6th, he had come in, and I think he was a little bit stressed, got there late, but, felt like he was okay to do the treatment. So start the treatment. I go to my office. Fast forward 30, 40 minutes. I hear someone scream out at the top of their lungs, "I'm in hell!" And I'm like, what is going on? I run into the room. I go in there, and this guy is like standing on top of the recliner, jumping up and down. "I'm in hell! Get me out of here!" And he grabs his mom's arm, and she starts freaking out. So of course everybody's freaking out, like, "Oh my God, what's happening?" I'm just like, in my head, what the F do I do in this situation? Because it's the first time it happened. But maybe I was just like, I'm gonna be calm. If I freak out, everybody else is gonna freak out. So I just walk up to him. I said, "Hey," I'm not gonna say his name, but let's just say his name was Bob. "Hey, Bob, it's okay." I orient him, and I just grabbed his hand and kind of released it from his mom so she can get away. And I just kind of held him and reoriented him to where he was at. Needless to say, he never came back and did another ketamine experience. But the purpose of that story is saying, like, if you're not in the right mindset, and you don't have the right dose, you don't have the right environment, and you're not careful, these trips can turn very dark and very scary. In fact, there's something called a K-hole. Okay, so a K-hole is an experience where the person is fully disconnected from self. So one thing I didn't talk about when it came to like the mechanism of action is that ketamine is a dissociative anesthetic. What that means is at high enough dose, a patient will almost have like an out of body experience. It's kind of like feeling like a spirit. Like you don't have a awareness of your body. So a lot of times patients will just, "Hey, am I breathing? Hey, am I alive? Am I still here?" Those are questions that patients may ask if the dose is too powerful for them, because they'll feel completely disconnected from their body. Okay. A K-hole is like that times 10. And it's this really like potentially dysphoric, scary situation. It's possible, and this is not a therapeutic use of ketamine, it is possible for someone to experience a K-hole in a pleasurable way. But a ketamine clinic, especially in an outpatient setting, should not be pushing people to a K-hole. The way I describe it to my patients is I'll tell them what a K-hole is. I'll give them a visual. Imagine it like, what's the movie? I can't think of the movie. The movie with the sunken place. I think it's called Get Out. But Key and Peele made the movie, whatever. And there's a scene in Get Out where the lady's hypnotizing the guy, and she's like spinning her spoon around the cup, and he's sitting in a chair, and there's a visualization of him like falling into the sunken place, and he's like falling to this dark place, like it looks like he's going in the water, but he's like fell into the chair and he's floating backwards. That's I imagine the K-hole to be. It's like a crater of darkness that you don't have much control over. And I tell my patients, our goal is, if the K-hole's over there, all I want you to do is come close to it and be able to look over the side, like when you go visit the Grand Canyon. I don't want you to fall in the Grand Canyon. I just want you to visualize, okay, there's something down there, right? So the K-hole, in my opinion, in a clinical setting is a place to be avoided. But you want to approach it because, to me, that approaching it is a way that we, I guess, ascertain if someone had adequate treatment or not, right? So I know I'm on a tangent, and we're talking a lot about the transformation phase, but a lot can happen in that transformation phase, and that's where you get your therapeutic benefit. And there's a danger in that transformation phase. So that's why I don't like patients to go to clinics where they don't adequately prepare you for the experience, that they don't adequately support you. So I think a good clinic will have someone available for you and there for you during most of your treatment. If they're not in the room with you, they should be close by that you can easily call them. Okay. Patients should have instructions of what to do with their thoughts while they go through an experience. Because if you don't know, you can really get scared really fast. Okay. And then a clinic needs to be prepared to help somebody if they do go off the rails and have a bad experience. And it's really just like what we call holding space. Like, I'm present with you. I'm orienting you. I'm telling you, who I am, that it's going to be okay. I'm telling them your heart rate's fine, your blood pressure's fine. I'm reassuring them. And then also, especially if you're doing IV, I can turn it off, turn the medicine off. And I know that it's going to wear off as we go into the next phase. And that reassurance can help somebody get through like a bad experience. So the transformation phase is a place of healing, but it's also not without risk. And if you're not educated on how to handle that, it can be scary for the patient and scary for the clinician. Okay. Now, final phase. Now that you've been through all that and went to the second place and or had the most wonderful, beautiful experience of your life with Jesus flying through the universe, one of the two, hopefully what you got is a measure of healing. And then the last phase is what I call resolution phase. So the resolution phase is when the medicine has started declining from its peak. So, the IV medicines run out, or you reach the time limit of how much you're going to get out of a nasal spray or an injection, and the body is clearing the ketamine from the system. Okay. As the body is clearing it, typically the patients kind of go back through those phases. So typically they'll kind of transition to this trance phase. Honestly, you just took an anesthesia medicine. So you're going to be kind of a little bit out of it, a little bit loopy, a little bit sedated, a little bit disoriented. And that's why, once again, when people are recovering from a ketamine experience, it's important to have a presence there, like have somebody help you with that. So the reason that these 4 phases are important to understand is, as a practitioner helping people with ketamine, understanding those phases will help you leverage each phase. Like, I'm going to ease them to this relaxation phase, and I've already prepared them what the trance phase is going to be like, and they know that their objective is to be the observer of their thoughts during the ketamine treatment. And I've taught them this either prior to the treatment or leading up to the treatment. So the analogy I tell patients, like, imagine yourself laying back on your back, looking up at the clouds on a slightly windy day, and you see the clouds and they look like they're just static and they're not going to move. And that one looks like a teddy bear, and that one looks like Eleanor Roosevelt or something. I don't know, right? When you look up at the clouds, they look static. But if you were to go in the house and grab you a cold one, lemonade, I was talking about lemonade, I don't know what you're talking about, right? And you come back out and they're back down, the cloud's going to look different. So the same experience can happen with ketamine, that patients will have a thought that comes into their mind during this experience, whether it be good or scary. It may feel static, but their job is to watch it and watch it pass through. When patients understand that, if they start getting dysphoric, they'll remember what you told them. They'll go back to their breathing. They'll observe the thought, they acknowledge it, and then it'll pass through instead of going down the rabbit hole and end up in hell, right? So your preparation, understanding these phases can help people transition to these phases. And also they know that if I get to a place that I don't like, it's temporary, right? I'm safe. The team has already kind of helped them leading up to the treatment, and they feel safe and they can sustain those things. That way you rarely will have dysphoric phases. And if you do, they're prepared for them when they happen. Okay. So that's an overview of a clinical perspective of the phases of what a ketamine experience is like. So the importance of knowing these things is the more education your patient has before they do the experience, the smoother it goes. Okay. So I guess in conclusion, the important thing to know about ketamine and Spravato and these molecules is that, one, we kind of need an alternative way to help people with depression. Antidepressants are helpful, but they don't help everybody. And most of the patient population that comes to see a psychiatrist are inadequately treated by antidepressants. So one of the tools we can use are the NMDA receptor antagonists. It's a mouthful, but that's just ketamine and esketamine. It's well researched, it's safe, with the right guardrails. Right? And it can change how the brain is firing, leading to relief where some other things didn't work. So with that background knowledge, now you know you have another tool that you can educate your patients about to make sure they're aware this option exists so they can leverage it to help themselves get some relief from it. Okay.